Just let me know if that's perfect. All right. If you have not already done so, please go over to the SEAETC and register for today's session. You can join by the link in the slide, or you can also do the QR code. This will ensure that you do get your continuing education credit with, but you do have to attend the full session. And then a post survey evaluation will be emailed to you, and then you should receive your certificate. A few introductions and announcements. Again, not much changes with this from session to session, but if this is your first ECHO session, please drop your information, including your name, your role, your organization in the chat. Even if it's not your first ECHO session, we do like to see who all is participating, so please feel free to include that information in the chat as well. Now give everybody a couple of seconds to do that. Also, I do want to add that if you have any technical issues during today's session, please reach out to Kimber Miller. She can drop her information in the chat. And Kimber, do you also mind to add the registration link for SEAETC into the chat as well?
Yep, it's already been added. I can add it again if you'd like.
Perfect. Okay, no, that's fine. All right. Well, I will go ahead and turn this over to Amber. And Amber, just please let me know whenever you're ready for me to stop sharing, and so you can walk us through the site.
Sounds good. Hi, everyone. My name is Amber Coyne. I use she, her pronouns, and I serve as the Syndemic Coordination Director at the Tennessee Department of Health. And we'll get into a little bit about my program and how we came to be and where we are situated. Next slide. I have no conflicts of interest to report. Next slide. So today we're going to kind of hopefully in a whirlwind go over a couple of things, understand at a very high level what data prompted Tennessee to take a syndemic approach to strategic planning and program implementation, define what conditions we're including in the Syndemic Tennessee, and the vision and the goals of that initiative to improve the health and well-being of Tennesseans. And then finally, identify resources available to address the syndemic through the Syndemic Tennessee initiative that you all can access. Next slide. Okay, so why take a syndemic approach? So really what kind of spurred the Tennessee Department of Health to take a syndemic approach to both strategic planning as well as program implementation was the HIV and hepatitis C outbreak that happened in Scott County, Indiana, among people who inject drugs. So following that sort of outbreak, the CDC conducted a federal vulnerability assessment to identify what counties were most vulnerable to this sort of incident. And in that assessment, they identified 220 counties across the country that were highly vulnerable to this sort of rapid dissemination of HIV and hepatitis C. And 41 of those counties are here in Tennessee. That then prompted EPIs and program directors within the Tennessee Department of Health to do our own vulnerability assessment to take a look at statewide vulnerability. And in that assessment, they basically identified that all of the counties in Tennessee are vulnerable to this sort of incident. And so you'll see a reflection of that vulnerability on the map with the darker shades of blue, indicating more highly vulnerable counties, lighter shade of blue, less vulnerable to this incident. But the takeaway message here is really all of our communities are impacted. Thank you, Kimber. Kimber has linked the dashboard where you can view this data in the chat box for you all. And we are in the process of updating this vulnerability assessment with some excellent partners in our community. Next slide. So that kind of takes a picture about where we think our communities are most vulnerable based off of a variety of indicators. These two maps on this screen are showing kind of a current snapshot of what we're seeing right now in terms of statewide vulnerability to HIV, viral hepatitis A, B, and C, the big three STIs, so chlamydia, gonorrhea, and syphilis, as well as substance use disorder, which for the sake of these maps, we're looking at overdose, both fatal and non-fatal rates. So that top map is going to show you counties that have fallen in the top 15 rates for all of those conditions I just listed. So chlamydia, gonorrhea, HIV, overdose, fatal and non-fatal, syphilis, viral hepatitis A, B, and C. And so the darker the shade of county, the more times that county has appeared in the top 15 rates. So I've pulled out Cott County as an example. And so Cott County falls within the top 15 rates for 5 conditions in the syndemic. And that includes fatal overdose, syphilis, and then viral hepatitis A, B, and C. Similarly, we took a look at some of the social determinant of health indicators that we know are really tightly connected to these health conditions and did a similar analysis. I pulled out Cott County here, and you'll see that Cott County falls within 4 social determinant of health indicators in the top 15. So high percentage of single parent households, high percentage of unemployment, a lot of individuals living below the federal poverty line, and a low median household income. So the takeaway from here is that our communities are predicted to be impacted by rapid dissemination of HIV and hepatitis C, and we're currently seeing our communities burdened by these various health conditions. Next slide. Okay, so now on to in the syndemic Tennessee and how we want to approach moving forward. Next slide. So syndemics can include a variety of health conditions. So at a baseline, a syndemic, there needs to be biological connections between the conditions included. There needs to be evidence that separate epidemics are occurring simultaneously. There needs to be behavioral connections between those conditions. And there needs to be kind of these larger social forces that are similar throughout those conditions. So when we look at all of the data, what we chose to include in the syndemic Tennessee are the following: HIV, chlamydia, gonorrhea, syphilis, hepatitis A, B, and C, and substance use disorder or substance misuse. Next slide. The vision for in the syndemic Tennessee, which was developed in partnership with community, is to end the HIV, sexually transmitted infection, substance use disorder, viral hepatitis syndemic, so that all individuals and all communities can achieve their full potential for health and well-being. Next slide. And to achieve that vision, we have 4 goals. These goals are kind of outlined in pillars, very similar to the ending the HIV epidemic framework. And so the first one is screen, so to identify Tennesseans in need of prevention and treatment services across the syndemic. The second pillar is prevent, so to increase access to prevention services, including harm reduction. Third, treat, increase engagement in treatment services across those health conditions. And then finally, respond, build resilient communities through coordinated care and by reducing those social and structural barriers to health and well-being in our communities. Next slide. So now let's talk about strategic planning, and this is going to be very, very high level. This was a 2-year community-informed process that had lots of moving pieces, but I want to just focus on the pieces in which were the main elements of community engagement. Next slide. So over the span of 2 years, so between October of 2020 and about July of 2022, 21, somewhere in there about, we had 80 regional planning meetings across Tennessee. So these were planning meetings where we presented data to community. We also presented evidence-based interventions to address HIV, STI, viral hepatitis, and substance misuse in our communities. And then we engaged in conversation to decide what sort of strategies we thought would work best in these communities. So like I said, 80 planning meetings, very extensive. And here's a couple of quotes from our community planning members who participated in that process. I finally have a voice. It's been wonderful with many different aspects covered from many different voices. And this was a planning member who is an individual living with HIV. And then one of our service providers who participated said, it's been great to be able to hear from professionals and people with lived experience and take what they have shared and make sure we are meeting the needs of our community the best that we can. Next slide. The other large component of this where we engaged community voices was our statewide syndemic needs assessment. So we had previously conducted HIV needs assessment. This was the first time that we brought in the scope of that needs assessment to include questions related to testing, prevention, and treatment services across HIV, STIs, viral hepatitis, and substance misuse disorder, as well as questions related to their social service needs. So in that, we asked about testing needs and barriers, prevention needs and barriers, treatment needs and barriers, and then social supportive needs and barriers. Next slide. This generated a wealth of information. So this is a very comprehensive 156-page report where we have broken down by various different communities and areas in our state what those needs were that were identified through that survey that over 1,000 Tennesseans participated in, as well as the barriers that Tennesseans are experiencing towards accessing those various services. Next slide. And all of this to say, so that was a process that took place a couple of years ago. We are about to kick off what we are calling ETS, or In the Syndemic Tennessee 2.0, where we're going to re-engage community and update those strategies so that we can make sure that we're moving forward in a path that makes sense for all of our communities, as well as our state departments. So this will be a collaboration between the HIV, STI, viral hepatitis programs at TDH, ORCO and OIA within the Department of Health, who oversee overdose prevention response activities, as well as data analysis. Our wonderful partners at the Tennessee Department of Mental Health and Substance Abuse Services, the Ryan White Part A's in Memphis and in Nashville, United Way, who is overseeing a large HIV prevention funding portfolio at this point, as well as UL community and community-based organizations serving Tennesseans. And really the goal of this strategic planning process 2.0 is to update those screening, testing, prevention, and treatment strategies, and to once again engage community to identify needs and services, as well as gaps in those services and barriers to accessing services. Next slide. Okay, so how did we come about creating the Syndemic Coordination Program? Next slide. So to really lead this effort, both implementing the current In the Syndemic Tennessee strategy, as well as the 2.0 strategic planning process, we have a small team, small but mighty team that was established at the Tennessee Department of Health. So the Syndemic Coordination Program sits right beside the HIV, STI, and viral hepatitis programs at the Tennessee Department of Health. Within that, we have what we call the SSP team. So two of our staff members, while they work on a lot of other cross-cutting projects, primarily focus on our syringe service programs and the application process, as well as providing technical and capacity building assistance to harm reduction programs across the state. Next slide. So now to give you kind of a current snapshot of the resources that our program is putting out into the ethos that you all can access. Next slide. So one of the core things that we do as a team is develop syndemic education materials. We make materials geared towards provider education, but primarily focused around community education related to HIV, STIs, viral hepatitis, and substance use disorder. So we're constantly putting out a ton of new resources. At the end of this presentation, I'll show you how to locate all of those on our website. Next slide.
I apologize, Amber. It's frozen. Hang on just a second.
No, you're good. It updated.
Okay,
The other
perfect.
project that we're working on is a project that we're affectionately calling the Tennessee Harm Reduction Hub, which will be on the Endless Endemic Tennessee website, where we are coalescing materials to help support emerging as well as existing harm reduction and syringe service programs across our state. So this includes materials related to how to navigate the application process in alignment with TN code, as well as provider, community, and client education materials related to safe reuse. Next slide. We're also pleased to announce that our program, following suit from our wonderful viral hepatitis program, are going to be launching our own Echo series. And so this is going to be focused around harm reduction. And we're going to have two arms for this series. So one arm will be focused on community-based harm reduction. So really looking at emerging and best practices related to harm reduction in non-clinical or non-traditional healthcare settings. That second arm will be really focused on how to integrate and implement harm reduction services in more traditional healthcare or clinical settings. So we're really excited to start on this journey and to model the wonderful work that viral hepatitis program has done and focus in on harm reduction. Next slide. And with that, we are pleased to announce our very first session. So we'll be kicking off this series. This is going to be a little non-traditional in the terms that it won't be an hour-long call because we have done a similar call in the past and it took a full 2 hours to get through everything. But we will be kicking off our first kind of harm reduction echo series with a policy landscape call. And that will be happening on Wednesday, May 14th. From 9 to 11 Central or 10 to 12 Eastern. And in this call, we will take a look at all of the legislation that has passed in Tennessee through this legislative season that may have impacts on people who use drugs and the programs who serve people who use drugs in the state of Tennessee. And then we'll also have some federal partners on that call as well, who will give us kind of a high-level overview of where we're headed in terms of harm reduction across the United States in this legislative season. Next slide. So we also have within our website, which I'll show you in just a second, a viral hepatitis page where we have oodles of viral hepatitis resources. So we have fast facts on hepatitis A, B, and C, perinatal hepatitis B and perinatal hepatitis C. We have a hepatitis C treatment locators for clients. We have tons of education materials and then information about this Project Echo series that you all are on right now. Next slide. Last thing that I want to plug is our Endless Endemic Tennessee language guide. So this is a comprehensive guide about compassionate language that you can use in the work that you do every day to foster trust and trust among providers and community as you're delivering care. And so this has preferred terminology related to HIV, sexually transmitted infections, substance use disorder, and the communities that are most impacted by these conditions. So you can scan that QR code to view that language guide. I also host an hour-long interactive language workshop. You can always email me if that's of interest to you or any group that you're working with. Next slide. And that concludes my presentation. And now, if you're okay, Lindsay, I will share my screen so that I can walk you through the ETS website and how to find some of the resources that I just mentioned.
You should be able to share your screen, Amber.
Okay, I think I've successfully done this. I'm usually a Teams girl, but we're doing Zoom today. Did that work?
Yes.
Okay, great. Okay, so our website is endlessendemictennessee.org. We've also got some other URLs, so if you accidentally type .com, it should reroute you to this page as well. So this is the homepage. Towards the very top, you're going to see the different health conditions. So that very last tab, Harm Reduction Hub, is the page that we're currently building out with oodles of different harm reduction resources. You'll be able to find information about the harm reduction Project Echo that we're launching on there very soon. And we'll also have a dedicated web page on this website for that as well. So towards the bottom of this, you'll see information. If you're ever interested in starting a syringe service program, we have a timeline of what that process looks like. And then we have oodles of resources about how to fill out that application. And then below that, we have a variety of client-facing education materials that you can download on topics related to safer use. So I'll show you just for example, this is a flyer related to how to use xylazine test strips. It's a half pager that you can download and print out for your clients or share digitally. As mentioned, we do have a viral hepatitis page on here as well. This screen right here is going to have those fast facts on each of hepatitis A, B, and C, as well as perinatal Hep C and Hep B. So it's going to go over client-facing education. You know, what is this? How is it transmitted? What are the symptoms? Is there treatment available for each of those conditions? Below that, you'll find a hepatitis C treatment provider locator. So if you are a Hep C treatment provider and you have not added yourself to the treatment locator, I would highly encourage you to do so that this can be really useful for community. And this is a CDC widget that we've embedded into our website. And then below that, you will find a variety of hepatitis C education materials newly added this week. We have added all you need to know about hepatitis C education materials in a variety of languages. So Spanish, Arabic, Kurdish, Kirundi. I think there's also French and a couple of others. Swahili, French, all of that. So lots of resources there. And then at the very bottom of that page, you'll see information about the Project Echo that you're on right now. And that will take you to the dedicated Echo page, which hopefully you are all familiar with, where we have information about this series, where you can request a speaker or topic or a case presentation, and then recordings of all of the previous Project Echo sessions. And then lastly, if you're looking for that report that I talked to you about, you can go to the Learn More tab at the very bottom of this page. And that's going to really break down what is a syndemic, how we're defining it in Tennessee, and then what data actually supports a syndemic approach here. And then towards the bottom, we have links to all of the data dashboards that are operated across the Tennessee Department of Health. And then our latest EPI reports, as well as that syndemic consumer needs assessment report, which, as mentioned, is like a wealth of data, 156 pages broken down by various priority populations. So that's kind of an overview of our website. I hope that you will visit it. There's tons of information there. And if you have any suggestions about how to improve that website, we're currently hiring a website contractor to do exactly that. So if you have ideas about things that would be helpful there, please reach out to us and we would be happy to consider that feedback. And I think that's all I have today. Thanks so much.
Thank you, Amber. Bear with me for just one moment while I return back to my screen. Okay, can everyone see that okay? Perfect. All right, so as Amber mentioned, if you do have questions about today's session or any questions about In the Syndemic Tennessee, please do not hesitate to email them or also visit their website. As Amber walked us through their website, it is loaded with oodles of information and resources. Does anyone have any questions for Amber?
Hey, Lindsay, I have a quick question. Sorry, I couldn't find my hand on here, my digital hand. May I ask
That's
it real
okay.
quick?
Yeah, go ahead.
Okay. Amber, I know that for the Echo, and I know I've asked this before, but I just got back from vacation and I need a reminder. For the sign up, is that something that you guys are going to be posting on the In the Syndemic website for the harm reduction Echo, or where can we find that once it is available?
Oh my gosh, trying to find all my buttons. Sorry about that delay. Yes, we will be putting it on the website. We're also going to be sharing it directly with the viral hepatitis team at TDH. So I'm hopeful that you guys will share it out with all of your ECHO partners as well. And that's coming soon. We're just working on getting all of the accreditation pieces in place so that we can offer CEs, which, as you all know, is quite a process. So we're in that process, but we will be sending out broadly information about how to register for that series. And we would encourage all to pass that along to their networks as well.
Perfect. So you have my word. I will save it and I will get it in the group chat.
Thank you.